X-ray changes seen in rickets are metaphyseal cupping and fraying, calcification of epiphysis is not seen, metaphyseal widening, yes, white sclerotic ring around epiphysis, no, osteopenia, white sclerotic ring is seen at metaphysis during the healing of the rickets, osteopenia, yes. So the X-ray changes seen are metaphyseal cupping and fraying, metaphyseal widening, and osteopenia. True about pectus excavatum. Pectus excavatum, body of sternum is curved inwards. In pectus excavatum, there is decreased chest expansion and decreased total lung capacity, and it is associated with prematurity, congenital heart disease, fetal alcohol disease, homocystinuria, Marfan syndrome, Poland syndrome, and Noonan syndrome. So true about pectus excavatum. It is more common in female, no. In severe cases, mitral valve prolapse may occur. Yes, congenital heart disease is occurring, so is associated. May be present at birth. Seen in Marfan syndrome, impairment of respiratory function, as there is decrease in chest expansion and decreased total lung capacity. True about osteomalacia. It is more common in male, no. It is more common in female. Low parathyroid hormone, no. In osteomalacia, it is more common in female. Increase in alkaline phosphatase level and in decreased calcium level and Luzer's zone on the X-ray. Increased alkaline phosphatase, decreased calcium level, Luzer's zone on X-ray. Genu recurvatum is seen in. Genu recurvatum or hyperextension of the knee is seen in trauma, rheumatoid arthritis, rickets, poliomyelitis, Charcot's, or congenital due to intrauterine positioning, due to position of the fetus in the uterus. So it is self-resolving. So the genu recurvatum is seen in rheumatoid arthritis, rickets, and poliomyelitis. This is genu varum, board legs, genu valgum, knock knees are the genu valgum. Genu recurvatum, hyperextension of the knee, so back knee. Genu varum, board legs, genu valgum, knock knees, and the genu recurvatum, back knee. Child diagnosed with hypophosphatemic rickets, choose the correct statement. Hypophosphatemic rickets. Serum calcium level are mostly normal. Yes. Raised level of alkaline phosphatase is seen. Yes. Hypophosphatemic rickets has X-linked dominant inheritance. Parathyroid is markedly raised, no. Pigeon chest is one of the characteristics, skeletal deformity, yes. So serum calcium levels are mostly normal. Raised levels of alkaline phosphatase has X-linked dominant inheritance. Pigeon chest is one of the characteristics, skeletal deformity. Biochemical abnormality in rickets. In rickets, there is low calcium and ALP is high. Low calcium and ALP is high. Wrist joint. There is cupping, splaying, and flaying of radius and the ulna. So it is of rickets. X-ray hand, most probable diagnosis. Healing rickets. On treatment at metaphysis, white line of Frankel is seen in the healing rickets. Which of the following features are seen in pediatric vitamin D deficiency? So it is pediatric. So the rickets. In rickets, rachitic rosary is seen, Harrison's sulcus is seen, pigeon chest is seen, and widening near the joints. A 2-year-old child with rickets is on calcium supplements and has a foot deformity. The child will be referred to a surgeon for the correction of the deformity when? For the correction of the deformity, growth plate healing becomes normal. Corrective osteotomy in rickets should only be done once radiological healing has taken place, otherwise the osteotomy will not unite due to defective mineralization. So the child will be referred to a surgeon only after the growth plate healing becomes normal. Osteomalacia is due to vitamin D deficiency. Rickets are seen in rickets all are seen except in rickets bowing of legs are seen, rachitic rosary is seen, kinotapes is seen, bleeding is not seen. A 30-year female has low serum calcium and phosphate with elevated parathormone. Diagnosis is vitamin A deficiency, as there is decrease in calcium and phosphate, but in osteoporosis the calcium and the phosphate levels are normal. Pectus carinatum is seen in rickets. Test for vitamin D deficiency, vitamin D levels. For vitamin D deficiency, we need to see the vitamin D levels. Hypophosphatemic rickets, mode of inheritance is X-linked dominance. Which of the drugs cause osteomalacia? Phenytoin. Loser's zone is a feature of osteomalacia. Osteomalacia is associated with increase in osteoid maturation time. Rickets in infancy is characterized by the following except craniotapes, rachitic rosary, wide open fontanelles, bow legs. Bow legs is not seen in infancy of the rickets, as long bones of legs get deformed when the child starts bearing weight. Therefore, deformities of legs are unusual before the age of 1 year. Decreased mineralization of epiphyseal plate in a growing child is seen in rickets. Basic pathological defect in rickets is there is defective osteoclastic resorption of uncalcified osteoid and cartilage. Osteoid formation is normal in rickets with defective mineralization. However, osteoclastic resorption of the uncalcified osteoid does not take place. Therefore, osteoid is laid down irregularly with widening osteoid seams and osteoid islets. A patient with raised serum alkaline phosphatase and raised parathermal level along with low calcium and the low phosphate level is likely to have vitamin D deficiency. As in osteoporosis, all the parameters are normal. Action of vitamin D is that it stimulates absorption of calcium and stimulates osteoclasts.